thank you so much for inviting me. I am very happy to be able to join you, but of course I would have liked to be there in person, especially now in Norway when it's grey and raining outside. So the talk that I will be presenting today is on mental health, as you said, and adolescents during the COVID-19 pandemic. So I would like to present some of the findings from our study on the consequences of social distancing during this time. So as in many other countries, on the 13th of March 2020, all the schools in Norway were closed, as well as most of the organized leisure activities and other social arenas, which really led to the strongest intervention in everyday lives of everyone in Norway. But this was especially true for young people because many of the social arenas where they usually would meet friends, they were just simply closed overnight. So this lockdown, it really hit young people particularly hard. And for example, in a report from Young Data, a national survey from 2019, about 90% of adolescents, they answered that they participated in some form of organized activity. So as you can see in the quotes here from some of the participants in our study, they said, "I was with people all the time, and now I'm only on my own, and I'm feeling isolated from social life. Even though nothing is happening, it bothers me." So it really shows an example of feeling isolated and missing spending time with friends. And in our study, I was wondering whether digital interaction could help support adolescents during this time. So social relationships are fundamentally important to us humans, and good relationships with others are also important for how we feel. So what is friendship, and why is friendship so important to us? So friendship is a type of relationship that is characterized by a very strong emotional bond. And research has also shown that it is related to our quality of life. And we also know that social support is an important resource for overcoming crisis. So going back to the 1930s, where there was a huge crisis, one of the factors that made people being resilient or overcoming this crisis was having those strong emotional bonds and relationship with others. So we know that social distancing is difficult, not at least during adolescence, because peers play such an important role in socializing during this time. And we know that having someone to share your worries with, your feelings, is especially, or it becomes increasingly important during adolescence, especially because you tend to distance yourself more from your parents and your family. So we wanted really to gain a better understanding of how these measures affected young people. And I especially wanted to focus on adolescents, as during the start of the pandemic, at least in Norway, there was a strong focus in media on elderly who were lonely. And also there was a lot of focus on young children and how important it was for these children to come back to school and to daycare. But there were almost nothing in the media about young people. So we asked adolescents to participate in an online survey through social media advertisements, through high school web pages. And there was about 700 high school students in the age between 16 and 19 that agreed to participate. They were on average 17 years. However, most of those who answered the questionnaires were girls. So about 80% of those who answered the questions were girls. Recruitment and data collection was initiated on the 1st of April, so only a couple of weeks after the lockdown in Norway. So we asked several questions about friendships and whether they had at least one close friend. So we asked about how many times they had met with friends physically. And we also asked about loneliness, such as how often do you feel left out? And how often do you feel isolated? Or how often do you feel lack of companionship? And we also asked about anxiety and depression, such as whether they felt nervous or shakiness inside, and about worrying too much about things. And then we also asked participants during the last week, how many hours per day do you spend on screen alone? So whether you spend time with no one in the same room and offline, but we also asked questions about how much time they spent on screen with family and on social media. And then we also asked how many chats or text messages do you send per day, and to how many different people. So what we wanted to know was whether, or we hypothesized that in-person interactions with friends, screen time with others, active chat to texting with friends, and gaming with friends would all be negatively associated with loneliness and symptoms of mental health problems. That is, we asked whether interactions with friends and in-person and digital would potentially protect against mental health problems and loneliness. So when we asked about friends, 90% of adolescents said they had at least one good friend at school. And as you can see from the figure, we also asked, how many times have you met one or more friends in the last week? And as you can see here on the blue, here, a third of the adolescents had not met any friends physically or in person the last week, while about 40% had met friends once or twice. So it seems like most of the adolescents were actually quite good at following the regulation by the government. And the government advice was to have no more than one or two friends, but actually what we saw, that was most of the adolescents chose to social distance, and they had not met any friends during the last week. So we know that most teens spend more time on screen, both alone and interacting with friends during the pandemic. So how can this influence mental health? So nearly all teens in developed countries are on social media, such as Snapchat, Instagram, TikTok, and Facebook. And a Norwegian study also found that about 70% of boys and 26% of girls spent more time online during the pandemic compared to before the pandemic. So during pre-pandemic research, there was already a growing evidence to suggest that different types of screen use would differently impact on our well-being. And we were interested in how these type of differences would relate to mental health during the pandemic lockdown. Also, pre-pandemic reports suggest that about 2/3 of adolescents, they spend at least 3 hours on screen per day. But what you can see in this figure, when we asked about digital screen time alone, we saw that about 60% said they spend more than 4 hours on screen alone per day. But what do we know about mental health during the pandemic? So there have been an increasing amount of research and publications on this. And the earliest publications on mental health problems, they were conducted in China, and they showed a moderate to severe mental health increase. And several studies from other countries have continued to show that there is an increase in mental health problems, especially in adults. And in the UK, about 1/3 of adolescents in the age between 13 and 18, they reported feeling lonely. Also, the Norwegian study in the beginning of the pandemic also showed that quality of life, self-reported quality of life had decreased among the adolescents during this initial phase of the pandemic. And what we don't know so far from those studies is that whether these findings would sort of show an increase from before the pandemic. And a recent study from North America found that from 12 longitudinal studies, which means that they followed the adolescents from before the pandemic until into the pandemic, they also found that depressive symptoms were increasing during the pandemic. They did not find that anxiety symptoms, such as feeling nervous and anxious, had increased, and they remain more stable. However, so far, whether increased digital screen time and social media would increase mental health problems or potentially protect against feelings of isolation during the social distancing, we really don't know. And so when we asked about loneliness, about 13% said they always felt lonely, and a little under half was lonely sometimes. So we also found that lack of in-person interactions with friends was associated with feeling lonely, and time on social media and gaming alone was also associated with feeling lonely. However, boys that reported gaming online with friends, they were actually less lonely. So although during the pandemic, digital interactions is an important meeting point to socially interact with friends, it may also be that it increases feelings of weariness and isolation, because it also lowered the time you spend face-to-face with your friends. So previous research has shown that low in-person social interactions and high social media use is associated with increased loneliness, of having more feelings of being lonely. So, but when we examined association with anxiety and depression, we found that lack of in-person contacts and meeting friends in person was associated with more symptoms of anxiety and depression. And we also found that time spent on social media was associated with anxiety and depression. And there were also some of the adolescents in our study who expressed that they were depressed, as you can see in the quotes here. So, I am more depressed and feel lonely, and I can't manage the digital teaching because I am depressed. Here I should also mention that girls, as we expected, reported more symptoms of being anxious and depressed, and they also were more lonely than the boys. So both in-person and digital contact with friends seems to matter. So we found that adolescents who texted with more people reported lower levels of loneliness and mental health problems. And we also found that those who spend more time on screens together with their family, they also reported lower levels of mental health problems. However, as you can see in this figure here, this differed for boys and girls. So more frequent in-person meetings with friends were associated with lower levels of loneliness among boys, but not with girls. And also texting with people was associated with lower levels of mental health problems for boys, but not for girls. As you can see here, the more they were in interactions with their friends, the lower level the boys had on mental health problems. But this didn't change much for the girls. So it may be that the contrast in social interactions during the pandemic is more evident in boys. For example, social interactions may have changed perhaps during the pandemic, and many of those who under normal circumstances report having several friends and peers, they may also continue their social interactions online. And I think this might be especially true for girls, since their social interactions are often more intimate and dyadic, and they tend to have more social interactions with one or two friends. And this may be more transferable to an online context, such as you can more easily interact face to face, sort of over FaceTime or chatting together if you're 2 or 3, as compared to boys who may socially interact more in groups. But I would also like to highlight that there are also some adolescents who reported some positive changes. So we asked whether there were any positive changes after the pandemic hit, so to say. And some of the adolescents reported feeling less stressed and more relaxed, as you can see in this quote. It can be pleasant to have nothing to do. I'm not used to it, so it's a little nice sometimes to have time to relax. Or I have more time to read books with family, reflect on different things, spend more time out walking. So for example, in our study, 97 of the adolescents, they said it was positive to spend more time together with their family. And also more than 100 said that they enjoyed having time to do other leisure activities. But I should also say that it was actually around 90 adolescents who just simply said no. There are no positive changes. So this will vary across our sample too. So in sum, so there has been much evidence that social media use can have a negative impact on mental health outcomes in adolescents. However, active use of social media, such as, for instance, texting and digital interactions, can help adolescents cope with their worries and stress during the pandemic. And our findings, they highlight that during the first weeks of the pandemic and social distancing, the more interactions, either in person or digital, the adolescent had with their friends, the lower levels of mental health problems and loneliness were reported. And we also show that gaming with friends may be particularly important for boys' mental health and feeling of loneliness, whereas social media may be more important for girls. But nevertheless, both in-person and digital contact with friends is important for adolescents' mental health. So I just want to end with saying thank you to all of our adolescents who participated, and to my colleagues at Promenta Research Center and Carleton University in Canada. Thank you.